Good afternoon. My name is Anette Järvi, and I'm the Global Head of Medical Affairs at Nestlé Health Science. On behalf of Nestlé Health Science, I would like to wish you all a very warm welcome to this symposium, Maximizing Nutrient Intake for Improving Clinical Outcomes in Disease-Related Malnutrition. The presence of chronic health conditions or comorbidities can render individuals more susceptible to disease-related malnutrition. Malnutrition, whether associated with age or underlying diseases, poses a significant risk factor for functional decline, increased morbidity and mortality, reduced quality of life, prolonged hospital stays, and escalated healthcare costs. Patients with or at risk of malnutrition often struggle to meet their energy, protein, and micronutrient requirements through diet alone, necessitating the use of nutritional support. At Nestlé Health Science, we firmly believe in the transformative power of nutrition to positively impact people's health and quality of life. And to further advance this approach, we work collaboratively with experts, researchers, healthcare professionals, scientific societies, and institutions through meaningful scientific partnerships. By working together, we aim to improve the health and wellness of patients, putting the patient at the center, enabling them to reach their full potential and enhance their overall well-being. We are confident that our collective efforts and collaboration will pave the way for better and faster recovery, improved patient outcomes, and a brighter future for those that are affected by disease-related malnutrition.